Lake McTighe with Metro. Lake is the principal transportation planner at Metro, working primarily in the areas of street design, transportation safety, and active transportation. Lake is managing Metro's Safe Streets for All project with funding from US DOT, working with jurisdictional partners and communities to develop strategies and actions to reduce deaths and serious injuries from traffic crashes in the region. And the first presentation is going to be on analysis for Metro's Vision Zero plan. So, Lake, you want to take it away?
I will take it away. Yes, thank you so much for the invitation to speak today. I trust you can see my slides.
Yeah.
Okay, excellent. Let me just actually, hold on one second. I cannot see my presenting slides. There we go. Okay. So yeah, really happy to be here. This is a little less on the technical side and more on sort of giving you a flavor of Metro's Safe Streets for All program. And I've been working at Metro for about 19 years and focusing on safety for about 8 of those years. And so my goal today is just to give you a sense of the work that we're doing, some of the data and analysis that we do. And I think it is valuable for modeling. I'll touch at the very end on some goals we have for crash prediction models, macro models at the regional level. There's so much I could cover and go into. So this is really just to give a snapshot, a kind of a high level, and then hopefully pique your interest and give you sort of ideas of where to look for future information. It's nice to see quite a bit of people that I know and some new names as well. So looking forward to meeting those of you in the future that I don't know. So this is, to start, I'm going to give kind of a timeline of regional transportation safety planning. And then I'll touch on some of these elements in a little bit more depth. So Metro really started to focus in on transportation safety in a very detailed and focused way in around 2010, so about 14 years ago. This was working with the federal government who wanted to see a regional transportation safety plan developed. And so we did some analysis, created our first state of safety report, looking at fatal and serious crashes primarily in the metro region, developed a regional transportation safety plan in 2012. It was not adopted at that time, but it really started to lay the groundwork of where we wanted to go. And at that point, we identified a 50% reduction target for serious crashes in the region. After that, we developed an active transportation plan, which really took a very strong focus on safety and looking at how to improve safety for people walking and biking and accessing transit in the region, and developed some bike and ped policies with a real focus on safety. In 2016, looking forward to the 2018 Regional Transportation Plan, we developed our first high injury corridors. And these I will talk about in a minute, but this is sort of the beginning of our regional transportation planning process focused on safety. In 2018, we did adopt the first regional transportation safety strategy, and I will talk a little bit more about that, with a Vision Zero target of 0 deaths and serious injuries by 2035. And that was, we developed the first regional safety policies, we developed objectives, actions to try to get to Vision Zero by 2035, convened an interagency safety working group to develop all of that. And that is where we first started to talk about and adopt the safe systems approach, which is a very effective approach for addressing safety, and I'll touch more on that. Coming right on the heels of the 2018 Regional Transportation Safety Strategy, we developed street design guidelines, which are outcomes-based street design guidelines with, again, a focus on 0 deaths and fatalities. So what types of street changes could achieve that? We also were really starting to emphasize safety outcomes in our regional flexible fund allocations and getting specific criteria, linking up that criteria with our high injury corridors and with our street design guidelines to identify projects that could help reduce serious crashes. We started to work on providing equity and safety forums, looking at provided a forum in 2020 on the safe systems approach, committing to providing regular safety updates to our Joint Policy Advisory Committee on Transportation, the Metro Council. So really making sure that safety is highlighted at these high-level transportation committees and at the Metro Council, both as sort of a single agenda item, but also elevating safety throughout all of the transportation discussions. And then in 2023, we again updated our high injury corridors, which I'll talk about. And we applied for the Safe Streets for All grant, which is giving us some funding to really begin to standardize and enhance our safety data and analysis over the next couple years. It's a great opportunity to really focus in on safety. So this is just a snapshot of kind of the timeline of safety at the regional level at Metro. So safety planning, this is mandated by the federal government. And I think I just want to highlight this because it is baked into all of the metropolitan planning organization work that we do at Metro. And there's sort of a baseline, and Metro, we have really attempted to go quite beyond that baseline and are working closely with FHWA and ODOT and other partners to really enhance everything that we're doing around safety in the effort to have better outcomes. So we do need to include safety as part of our transportation planning. And we need to consider like what types of projects and strategies are going to increase safety for all modes, including drivers, people walking, bicycling, riding motorcycles, et cetera. And then we need to show in our Metropolitan Transportation Improvement Program, the MTIP, how those investments that we've planned for are actually advancing towards our performance targets. At another level, advancing our safety goals of reducing serious injury crashes is very integrated and important to supporting advancing other goals at the regional level, reducing greenhouse gas emissions, advancing equity, minimizing environmental damage, and increasing active transportation. These things are all so interrelated, and so we see reducing serious crashes as a key element of achieving these other outcomes and not in conflict with any of them. So the Regional Transportation Safety Strategy, the first adopted safety strategy for the region, one of the first safety strategies of any metropolitan area in the country, was adopted by the Metro Council in 2035. And really importantly, we moved away from the 50% reduction of serious crashes to a Vision Zero target. And that is an ambitious target, but places that have adopted these targets have really shown that they've been able to make great advances in reducing serious crashes when they have these ambitious targets paired with the safe systems approach or other very approaches that are very focused on reducing overall harm. This plan is a topical plan of the regional transportation plan, so it does inform, it's part of the regional transportation plan, and it has been used in the last 2 RTPs to inform the types of projects and programs that are being brought into the plan. Overall, the policy direction for the Greater Portland area, which is defined in the Regional Transportation Plan, is that Vision Zero target, to use the safe system approach, and that is very much focused on lowering speeds and increasing safety for all users, to prioritize safety in transportation projects. Obviously, all projects should be safe, but this is to focus in on prioritizing projects that will reduce existing crashes and prevent them from happening in the future. Tying safety to equity to reduce the disproportionate impact on Black people and Native American people, other people of color, people with low income. And to really focus in on immediate interventions, not just waiting for very large, expensive projects to occur. And then making sure that safety is a key consideration when defining system adequacy or deficiency, so that we are not degrading safety and that we are actually moving in the other direction and improving safety. So the safe system approach is a foundational framework that is adopted in our regional plans and that we are using to help define all of our actions, our communications, how we are moving forward with safety in the region. And we're using this approach because it has been proven to be very effective in places where it is implemented. Partially, it's because it's embedded in a set of principles where death and serious injury are unacceptable. It acknowledges that humans make mistakes, that humans are vulnerable to crashes, that responsibility is shared and safety is proactive, and that redundancy is crucial. And that's looking at these kind of layers of safety, of safe road users, safe vehicles, safe speeds, safe roads, and then post-crash care, so that when one part of the system fails, there's another part of the system to prevent serious injury from occurring. Another framework that we're incorporating is the upstream public health approach. And this, again, we're using this framework because it is proven to work when you take a systemic approach towards safety rather than focusing on individual action. You get better overall results. And so it's creating that upstream healthy transportation system, which is proactive to prevent serious crashes from occurring in the first place. And then if a crash does occur, it is not serious because the speeds are slow, because there's enough buffer, there's various interventions. So this upstream public health approach, which is focused on equity, when paired with the safe systems, has been, again, proven to drastically reduce serious crashes where it's been applied. So one of Metro's primary roles is tracking our performance around safety. So this is just a snapshot from one of our safety performance reports. Unfortunately, we have been moving in the wrong direction. Now, we do have very ambitious targets. Each of our annual targets, so here the annual target for 2021 is shown in the middle column. Those were established when we adopted our 2035 Vision Zero targets. So we adopted targets for every year moving forward to 2035 using a S-curve analysis to identify what types of targets do we need to be meeting each year in order to get to zero by 2035. Serious bike crashes are the only target that we've been moving in the right direction. But for these 5 federal performance measures, we are moving in the wrong direction in number of fatalities, fatality rates per VMT. We're also moving in the wrong direction in fatality rates per capita, which is not shown here, and then for non-motorized fatalities and serious injuries. So this is another kind of core function of metros. These are the high injury corridors that I identified earlier in the timeline. And we first identified these in 2016. We updated them in 2023. We update a policy map every 5 years as part of the regional transportation plan, and that's used to help us prioritize projects and funding through the regional transportation plan and through the regional flexible fund allocations. These are the roadways. Just 6% of roadway miles in the region where 68% of traffic deaths and serious injuries are occurring. So this type of analysis helps us. It's just one way of understanding serious injury crashes, but it helps us zero in on those roads where we could make the biggest difference. They're usually the most complicated roads, typically urban arterials, a lot of VMT, a lot of users, a lot of different movements, but they're also where we need to be focusing our attention if we're going to make a dent in serious injury crashes. 76% of pedestrian crashes, for example, occur on these roadways and also within equity focus areas. So to start to get at that, in this last regional transportation plan, we developed a safe and healthy urban arterials brief. And this was really to get into, what are some of the challenges preventing us from fully investing in these major urban arterials and addressing safety in a way that would start to turn our trends around and move us in the right direction. And so this brief identifies some of those challenges and some potential opportunities, some of which were implemented in the regional transportation plan. This slide is really giving us, we start to look at how are we addressing safety in the regional transportation plan. We don't have a regional crash prediction model, so we can't actually say this is how many crashes we're going to prevent in the future. But what we do is we have developed a definition of a safety project, and we count the number of projects that are in the plan, whether or not they're on a high injury corridor, the level of investment for these types of projects. And that gives us at least a sense of, are we devoting enough resources to safety specifically to address serious injury crashes? All right, I see I'm way behind time here, so I'm going to speed it up, even though I'm already talking kind of fast. So street design guidelines, we've developed these to help us support our safety goals. Check them out. There's very focused on safe streets and safe people. We have this grant that is now underway. We've got a 2-year project. The focus is really to understand the challenges, using data and analysis to engage and coordinate with our regional partners and communities, and to focus on solutions more than anything in terms of understanding what needs to be done, how can we better coordinate and get on the same page to move the needle forward. We are creating sets of local high injury corridors and high injury intersections, including for bike and ped, and those are going to be available soon. This is just another way to understand where these serious crashes are occurring at different geographies. We'll be supporting city and county safety action plans. We've got some sub-recipients of our grant, Tigard, Washington County, and East Multnomah County. And then we're also working with other agencies that are either updating or developing safety action plans, focusing on best practices and data and analysis, et cetera. We'll be doing in-depth pedestrian and speed-related crash analysis. And this is really just to try to better understand what factors are contributing to these types of crashes, speed-related and pedestrian. And then using some different analysis approaches like a RCVE, working with partners to narrow in on solutions and strategies, because really we do know a lot of the strategies that work, but it's getting to that shared agreement that these are the key strategies that we all need to be coordinating on. We're also going to be developing a safety hub where it's kind of a one-stop shop to go to get data analysis. We want to really be able to make our data and analysis easily and widely accessible to the public and to our agency partners, so the data can be quickly downloaded, that it's easily updated on a regular basis. We want to have strategies, countermeasures, videos, toolkits. We're working on all of this over the next 2 years to really, again, have that shared common strategy that we're all moving forward on. So, and then on the horizon is looking at a macro level crash prediction model. This is going to help us set, different types of targets within the regional transportation plan. It's going to help us estimate the necessary type of safety investments, give some more and better information to decision makers to understand if they are making the right decisions around safety projects and programs in the regional transportation plan, and then understand the impacts of projects on safety. And then I'll end with just some strategic considerations moving forward for our regional safety program. Metro is really around leading with safety policy. We want to be a major resource for data and analysis for our partners. We don't own or operate the transportation system, so our role is that convening, providing information, helping to coordinate. There's a lot of efforts underway, legislation, funding, coalition building that intersects with safety. And our ideal is to make sure that safety is woven throughout. And again, there's a shared idea of what the problem is and what the solutions are. And that while there's agreement among agencies and advocates and decision makers that safety is really important and we need to do more, there is less agreement about what to do and how to do it. And that's one of our focuses over the next 2 years, is to try to get to, all decision makers saying, yeah, managing speeds for safety and lowering speeds in urban environments is really critical to safety. Achieving safety outcomes may take decades, we know that, and we're benefiting from decisions made decades ago. So as old challenges are addressed, new challenges come up, right? In-car safety has really improved, but now we have taller vehicles that are contributing to pedestrian deaths. And then success is contingent on many factors, and a big factor is that agreement on a strategy among a diversity of leaders. So I will end there, and appreciate that was a bit of a whirlwind, but I just wanted to give everyone a taste of our regional safety program, and hopefully pique your interest and give you some breadcrumbs to follow up on. We've got a lot of very interesting data and analysis. I didn't go into depth because usually those things take a fair amount of consideration to really understand, see and delve into it. So starting there, happy to always come back and just give you a snapshot of a particular data area. So thank you very much for your attention and time.
Well, Lake, thank you very much. That's very interesting. And I know there's questions. In fact, Alex was quick to get his hand up. Looks like we got about 7 minutes. So Alex, go ahead.
Yeah, you got to be quick on the draw. So I really appreciate the honesty in the metrics that you displayed between the 2015 and the 2021. I think it's great to be ambitious and to show just kind of clearly where we're headed. So my question, which might sound like, why isn't Metro doing this? But I don't think anyone is doing this. So it's not really, it's not a knock on Metro, just kind of a curiosity if it's been discussed. As you showed that slide, as you were showing the trend, which I think most regions are on, where things are not looking better, they're looking worse. I was curious what in that time period, that 2015 to 2021, Metro has invested in. So I'm curious if there's like a list of, these are the things that have been kind of attempted Also this is also politically like probably a non-starter, but I'm curious, what are the ideas that, Metro would have liked, what's on the wish list of things that they would have done in that time period, but potentially laws or agencies are standing in their way. I think it'd be good to kind of start that, like, I don't know. I think it'd be good to put different agencies on notice that, these are things that we'd like to do, but, for a variety of reasons, we're being blocked from accomplishing these, and we believe they're contributing to this trajectory that we're on. Anyways, I'm just curious if anything like that had come up. I really like a lot of what you're talking about was kind of looking forward, which I think is really important. But I like that monitoring piece and just kind of, assessing what have we attempted and why are we, what do we think is blocking us?
Yeah, thank you, Alex. Those are very important questions. And yes, we have done that to a certain extent. I will post a couple links. So we did a progress report on our safety strategy in 2021 that did I did interviews with all the different agencies working on safety and kind of looked at the actions that we had identified in the safety strategy and how much progress we had made on them. So I'll put a link to that. And then I just gave a safety update report, which I'll also provide a link. It was a report to JPACT and the Metro Council specifically because they are the entities that are responsible and accountable at the agency at the regional level. And it was looking at, kind of what's been done and what more do we need to do. And I will say one of the challenges with both reporting on performance measures and then looking at what's done in transportation at the regional level is this sort of time lag, right? So we're reporting on 2021 performance and some of our projects that we funded, we allocated funding to in 2015 are just now starting. So there's like this weird kind of lag time. And so it can be challenging to sort of say, are we doing the things that are giving us the right outcomes? The city of Portland, just finished the Division Street project, all the safety improvements around Division Street and FX. And, they still haven't been able to give like a full accounting of the safety outcomes with that, even though there's like this kind of demand for it. And so it takes a little while to assess. And really, you can look back to the 70s and just now start to see certain trends coming, right? So it can take a while to really understand what types of influences are happening. We can learn from other places. So just a quick example, blood alcohol content level. Some European countries, they have drink driving. You cannot drink at all, right? They have 0 blood alcohol content level. Utah went down to 0.05. And they think there is a very positive impact from that. So that to change the blood alcohol content level in Oregon has been attempted several times from 0.008 to 0.005. And it keeps failing or just not even moving forward at all. But that could be something, like that's the type of thing that could have a good impact if we can move forward with it. But we need that kind of shared strategy and agreement among decision makers. Like, yeah, this is an important thing. And is it the most important thing to focus on? At the legislature, it's actually quite hard to get any time dedicated fully to safety. There's other things that are taking precedent that do impact safety. Housing impacts roadway safety, drug use and health services impacts roadway safety. All those things do contribute, but I'll provide a couple links, but measuring kind of what's working and demonstrating that using case studies is critical for decision makers to kind of be convinced that they should be dedicating some of their time to these things. And I do think that a crash prediction model will help us with that, because the models that I've started to look at that are just in their infancy for a macro level regional planning model does look at other factors, everything from age and other different demographics, education level, incomes, all those things contribute to safety. And so you can actually be addressing roadway safety by, focusing on some of these other things. So it's a very nuanced, so I could just talk about, I'd love to have like an hour-long conversation on this, but I'll stop because I know you guys are very busy.
Thank you.